Good evening, everybody, and thank you for joining us here at New Teeth Now, where shortly we will be talking with Dr. Richards. Good evening, Dr. Richards.
Good
How
evening.
are you doing?
I'm good, thank you.
Good. So
Always fun to be with our British girl from overseas.
I'm not from England, no, I'm from Kentucky.
Oh yeah, right.
Yeah, you know, that other state. You see a lot of out-of-state patients, don't you?
We do, yeah.
Okay.
And some out of the country.
Very interesting. And how would that procedure work? Because it's New Teeth Now, which means it's done in a day.
Right.
How would you see a patient from out of state or out of the country?
Well, they come and stay for a few days, get some preliminary work done. Some come for a vacation, hit the Tampa, Orlando areas and do an extended vacation. Some have relatives here who see what we do and make a phone call to their relative in Alaska who comes down and stays with the relative while they have everything done. And, as you know, a lot of what we do is done, and then after they've recovered for a day or two, they can go back home, and then they're just healing for a few months. And then, coming back and getting things wrapped up at a later date.
And it's a very specialised procedure. This isn't something that I would want to do just because my teeth are crooked or because I don't like the way that they look, is it? What sort of people?
It's typically done for disaster situations.
Okay.
Somebody that's got a mouthful of bad teeth, or they had bad teeth and they lost their teeth due to periodontal disease, and they find themselves in dentures. I saw a lady today in her 30s, had her teeth removed 6 months ago. She's found herself trapped in dentures and she can't stand it. So we're going to do the New Teeth Now procedure for her.
That's brilliant.
Yeah.
What's the difference between a denture and the New Teeth Now procedure? Other than obviously it's not removable.
Well, we have an example of a denture up here, and we have examples of the bridge work that would go into someone's mouth after having the New Teeth Now procedure. On one hand, you have this large chunk of plastic that is a denture, and on the other hand, you have a small bridge made out of zirconia with porcelain. And so there's no comparison to the type of teeth that a person ends up with after the New Teeth Now procedure.
So show me the denture again. That's got a large palate. That has to get...
So this would
so
go
annoying.
into a person's mouth and cover their palate. And it has teeth on it, and it's plastic. And it stays in either with suction, ideally, or with Polygrip, or some other brand of denture adhesive.
It just sounds painful.
The lower one's even worse. These may be tolerable to some people, but the lower ones are more of a trick to wear.
At
least that's what they say. I don't have dentures.
Right.
So.
And I don't believe you ever would with the procedure that you do.
Not.
No, definitely. So is it possible that somebody could come in and just get the lower jaw done if their upper denture is fine and they're not got any issues?
Yeah.
Okay.
Not everyone would need to have the entire upper and lower done. We do a lot of single uppers, single lowers. Yeah, absolutely.
Very interesting. So let's get to know a little bit about you. We're going to go to this slide now. It states that you're board certified oral maxillofacial surgeon. That is a mouthful. What does that mean?
Well, to become an oral and maxillofacial surgeon, one first graduates from dental school. And then in my case, I did a 4-year hospital-based post-dental school residency, 1 year of which was a straight 12 months of anesthesia, and then 3 years doing mouth and jaw surgery. Nowadays, there are some 6-year programs out there where the person ends up with a medical degree in addition to the dental degree. So they're a DDS, MD, oral and maxillofacial surgeon. So there are beginning to be more and more of those people around. And then board certification, as in any field, just means that you meet some certain level of knowledge that is established by your parent organization.
Does that entail a lot of tests, a lot of...
Typically a written and an oral test
Really, an
to
oral
become
test?
board certified. Right. Yeah.
So you have to sit in front of a panel and
Right.
really know your stuff before you go
Correct.
through it.
Yeah.
It also says that you have 38 years of dental experience. How is that possible? Because I don't think you quite look 38.
Yeah.
So you,
Well,
you doing this since you were born? Is that what's been going on?
No, actually, this is my 39th year here in Lakeland.
Really?
When I finished my residency in, that would have been June of 1980, I came back here, which is my hometown, and started. So I've been here since July of 1980. So this is my 39th year here.
Wow. What changes?
And I finished dental school in 76 and then did the four-year residency from 76 to 80 in Jacksonville, and then came to Lakeland.
And what sort of changes have you witnessed going that far back from a denture and then being the innovator of new teeth now? You know, what kind of changes are you adapting to and still going through?
Well, in my career span, I've seen the entire evolution of dental implants.
Wow.
Because when I first came into practice, we were doing blade implants, we were doing ramus frame implants, we were doing stuff that was proprietary, it wasn't precision, it wasn't titanium. And then the Brandmark stuff came into the country in 82, 83. So in my span from 80 up through now, I've seen the entire evolution of dental implant, the modern era of dental implants.
And worked with it.
Yeah,
You've
absolutely.
been hands-on the
Yeah.
whole way.
Yeah, I mean, currently in this practice, Dr. Kirkpatrick and I place over 3,500 implants a year.
How many?
Over 3,500 a year.
Oh my goodness.
So, we have a vast experience in seeing what works, what doesn't work. And as we'll talk about later, various advanced techniques such as zygomatic implants.
Well, I was actually just going to touch on it. So people that are watching right now that are in dentures that have been told they can absolutely not have dental implants, is there a way that you can still provide them with the new teeth now procedure?
Well, if you hear that you don't have enough bone for dental implants, you need to come see us, because you may be talking to a much less experienced person. You probably are. And we do some special techniques, particularly in the upper jaw, which is called zygomatic implants, and they go up into the cheekbone, and they don't require bone grafting. You can attach teeth to zygomatic implants the same day. We've done over 1,000 of them. Actually, we do more zygomatic implants in this practice in Lakeland, Florida, than any other practice in the United States.
Wow.
And the reason I know that to be true is that the people who make the zygomatic implants have told us that. Told us that in Chicago last year at the AAOMS meeting. So we do a lot of advanced techniques. I saw a lady today that had been to 3 different offices and had been turned away. And when I assessed her situation, it was like a no-brainer. So you have to understand out there in dental world that you could be dealing with a general dentist that took a weekend course on placing implants and has minimal experience and knowledge, or you could be dealing with a more advanced practitioner who still doesn't do advanced techniques. And so as we talk more about what we do here, I think people will gain an appreciation for what we do and how we're different.
Definitely. And you said that Lakeland's your hometown. You've built this building from the ground up, basically, and added facilities to it.
Right.
To make it run as smooth as it does.
Well, we recognized a few years back that when you're doing complex implant cases involving maybe the upper jaw, the lower jaw, or both, that it's very difficult to proceed along the traditional dental model, and where the person comes to the surgeon and they have the surgery and they get up out of their chair and they go to the restorative dentist who makes the teeth, and so then the restorative dentist and the surgeon interface with a commercial dental laboratory. So you have these 3 rings, it's like a 3-ring circus, and there are these intersecting parts of the rings, And so that just doesn't work out that well in complex situations. So a few years back, we began to assemble a team and to put together the model, the business model that we now have, where we have the surgeons, the restorative dentist, and the lab, and the anesthesia team all under one roof. So we're all here, 2150 Hardin Boulevard in Lakeland, Florida, the surgeon, the restorative dentist, the lab, and the anesthesia department. So we don't outsource anything, and it's a one-stop shop. So a person can come here and they get everything done, and there's nothing outsourced.
I love that, because doing some research, there were other places that offer a similar sort of thing called, you know, like Teeth in a Day or
Right.
Teeth Now.
Right.
And I couldn't understand how somebody could, you know, go in that day, because there's a final set of teeth that patients are going to get.
Right.
And obviously through the checkup visits, which they can, if they're out of state, they can come back for checkups. I couldn't understand how they could visit, get teeth that day, and then leave and never go back to that
Right.
person. Because
Well, like going to like, you'd be referring to flying from, say, Lakeland, Florida, flying to Las Vegas.
Right.
And having a procedure and then getting on an airplane and coming back home.
Yes.
And what do you do if you have a problem?
Yes.
You come see us. You come to New
Right.
Teeth Now in Lakeland, where you live, and expect us to take care of it. That's what you do. And
how many of these cases have you taken care of? You sound experienced.
And we've seen a few. But, you know, the people that go to Costa Rica and all over, you know, we see those people when they have problems and they don't want to go back down there. But I forgot what we were talking about. But in any event, that certainly is a problem. But there are some other people who have tagged on to that name. So that if you go on the internet and you search New Teeth Now, there all sorts of things might pop up that are supposedly New Teeth Now. And so it's become quite the thing to go after, I guess.
Right, but you've progressed it from Teeth in a
We're
Week.
the original New Teeth
You're the
Now.
originals. There you go. And you always want to go with the original brand.
Yeah.
So let's take a little look at this model, because it gives everybody a visualization. This is a fixed upper hybrid. So it's pretty much what you showed us with the, you know, the zirconia final cut.
Right.
And this is a bit of an older looking model, because there's only 4 implants. Now, sometimes you could do 6. Is that right?
I typically do 6 minimum.
Okay.
And they'll see the term up there, fixed. Fixed means it doesn't come out.
Okay.
Upper is obvious. It's your upper teeth. Hybrid, you know, people understand what a hybrid car is. It runs partially on gasoline and partially on electricity.
I didn't know that.
So it's
thank
a
you.
hybrid. Well, you know, in England,
Now I
they may
learned
not have
something
that
new.
stuff. But a hybrid bridge is a type of bridge where the position of the implants and the position of the teeth is disconnected. If you're doing traditional bridge work, then the implants have to be placed site specific so that the position of the implant is very precisely lined up with the tooth. When you're doing hybrid bridge work, that's not the case. So you could put 6 implants and not a single one of those implants has to be lined up directly with the tooth, because the teeth are disconnected from the implants. The positions are. And so these work well in situations where there is bone loss, where you could not do traditional crown and bridge work.
Okay. That makes sense.
So a person comes in, they've been wearing a denture for 30 years, they don't have a lot of bone. It would be virtually impossible to put a series of implants into their jawbone and then hook conventional fixed crown and bridge work to it, because they've had loss of the bone and loss of tissue.
But with this procedure...
But the hybrid can replace the missing tissue with fake porcelain gum tissue, and the teeth can then be the normal size, shape, and length, and there aren't any big gaps between the gums and the teeth because you're filling it in with fake porcelain gum tissue,
So
and it works out well.
we had a question come in, and they were asking about the cleaning of the teeth. Since they don't come in or out of your mouth, how would you take care of them and maintain them?
The same way that you would take care and maintain a bridge that is glued onto your natural teeth.
Okay.
A lot of people have their own natural teeth. They have a bridge. The dentist takes the bridge, fills it with cement, puts it on the prepared teeth. You cannot take that bridge out. It may be 3 teeth long, it may be 4 teeth long, it may be 12 teeth long. It's a bridge. It's just like this. And so how do they clean it? They clean it with a water pick, with these little interproximal brushes. They clean it with a toothbrush. All of those same cleaning methods are used on the implant bridge. There's only one difference. The bridge on your teeth, you can develop tooth decay if you don't clean under around it. And if you don't clean under around these, your tissue may become inflamed, but the implants do not develop tooth decay. So these are actually less sensitive to cleaning in that respect than a tooth-supported conventional fixed bridge.
I sort of want these the more you're talking about them, because my crown bothers me.
Yeah, but these
all
are
the
fake. I mean, these aren't as good. I'll say this, these are not as good as your natural teeth. If you have
They're
natural
looking
teeth,
pretty good right now.
yeah, they look good, but if you have your own, I mean, it's like an artificial leg.
Right.
I mean, it's artificial. Okay, they're good. This is the state of the art right now around the world. This is about as good as it gets.
Compared to natural teeth.
But you're better off with your natural teeth. But if you have neglected your natural teeth, and all of your teeth are rotten, and they cannot be fixed, even if you wanted to have them fixed, if they were so far gone, if your teeth are so far gone that you would do anything to keep your teeth, but you can't. This is as good as it gets. Or if you're sick and tired of dentures, this is as good as it gets.
I love that you mentioned that, because we have one of your patients, Ione. I don't know if you
Right.
remember her.
I
We'll
do,
take a little
yeah.
look at her picture. And her before, she's not even really smiling. That was her smile.
Right.
And her after is incredible. Now, she had similar situation going on. I think she only did one jaw, actually.
I think we did the lower, yep.
Yep. And she had similar situation going on, wouldn't smile, teeth were decayed, they needed to be,
Right.
removed, and you gave her back her smile. How rewarding is that? To do that on a daily basis? Because you are doing this day in, day out.
Right, right. Well, it's very rewarding. You can take a person and, they're hurting. They have infection in their mouth, which then, circulates around their entire body. It affects their general overall health. And you can make them disease-free and give them something to smile about. Whereas before, they don't want to smile. And so we see a complete transformation of, not everyone, but we did with this gal. And you can look at her before, her hair, her clothing, her makeup, just everything. She had a much more positive self-image, and I don't want to make a big deal out of that, but it is quite true that if you have a bad looking situation, I mean, when you're talking to somebody and you're up close, let's face it, your teeth are a big deal, and if you have like periodontal breath and you're as close as you and I are, I mean, you can literally smell it. And so, when that's gone, I mean, that's a huge deal.
Right.
But people who don't have that don't really understand what a huge deal that is.
100%.
We're able to help people with that every day, and I mean, it's kind of neat. And then to see some of them really undergo a transformation is pretty cool.
I think it's important that we touch on it, just because there are so many people out there that are suffering, that don't smile in pictures, that are, avoiding family events and situations because of their teeth. So something like this could really, really reach out to them, and I just think it's amazing what you do.
I mean, I've talked to young guys in their 30s and 40s, and they've told me, they said, I'll go to a nightclub and start chatting with some gal, and I kind of get up within a couple of feet, and he said, I can actually see it in their face.
Yeah.
They smell my breath. and I mean, it's over.
Right. And it's
And
just got to
so,
be crushing. It's got to be...
and that goes both ways with women as well.
Mm-hmm.
So, it's a big deal.
I remember when I was answering phones, I had one gentleman that would call in and hang up the phone. I couldn't see him through the phone.
I know who you're talking
about. Do you remember?
about. Yeah.
And he would call in and call in.
From
We
City.
finally got, familiar with the number that kept coming up. And one day he plucked up the courage and he spoke, and he just came out with everything, and we booked him in.
Yeah.
And I think he even still comes in for checkups now.
I
and
think that guy drove up to the office and couldn't get the nerve to come in.
Yes.
So he drove up to the office, drove around, went back home.
Right. It just shows
and then
how
set
hard
up
it is.
another time to come in,
Mm-hmm.
and came in and talked, and once he got to know us and we got to know him and everything, I think we did his upper jaw, and he's a nice guy.
No, he's so appreciative of it, and it's just, it meant so much, and it literally changed his life. So you are doing more than just giving people back a smile, you're giving them back their life.
He's the one that wanted to make a video of how to clean the teeth.
Yes.
And he was using knitting yarn like you would a shoe shine, and he'd thread that under the teeth, and I mean to tell you what, he had it down. Yeah, he really did.
That's great.
Yeah.
So this is a picture of the Zygomatic implants that you were talking about. I love your story about how you learned how to place these.
Right.
So just give us a recap for people that are new at the webinar. It's
So
a pretty new thing.
Yeah, back about 05, 04, 05, somewhere along in there, I had a patient that had no bone in the upper jaw.
Mm.
And at that point, I was doing things traditionally with what we call a sinus lift. And I went in and I lifted up both sinuses and put bone under the membrane, and we sat back. She had no bone.
Mm.
So we let it heal about 10 months. And I went in to put the implants in, and the artificial bone that I had put in was just sitting there like I had put it in yesterday. Nothing had happened.
No way.
No
Her
way.
body was just rejecting it.
Well, it wasn't rejecting it. It's just that she had so little of her own bone and poor blood supply that it just never really got off the mark. So I took all of that out, cleaned it out, suctioned it out, used a different material, let it heal again, same thing. So we were faced with a situation where she had had 3 areas where I put implants into her own bone, and those 3 solidified. And so we made her a regular denture, just like this one we were looking at earlier, that had some like trailer hitch balls in it so she could snap it in and out, and it was better than what she had.
Mm-hmm.
So about that time, Nobel Biocare had a meeting in Las Vegas, 2006 or 7. And there was a guy there named Ed Petrosian, who's a big zygomatic implant guy. And he was doing a talk on grafting versus non-grafting solution for the person who has no bone in their upper jaw. So I said, hey, that's for me. I'm going there. So I went there and heard Dr. Petrosian's presentation. And I went to the Nobel people and I said, I got to learn how to do these. Find me a place to go so I can go, scrub in with a surgeon who does these so I can learn how to do them. So then I was introduced to Leslie David, who is a gal oral surgeon in Mississauga, Toronto, Canada. Went to Canada. Stayed there a couple days. She placed 3 zygomatic implants, and I assisted her. And I came back home, and I think 2 days later, I put my first ones in.
In the lady that was failing?
I think I did, actually, in the lady that was failing. And that was either the fall of 06 or 07, I can't remember.
Mm-hmm.
And so, it's just all history from there. And in those 11 years, or 12 years, however long it's been, there have been a lot of modifications, and we've done so many zygomatic implants now that we really have that particular treatment modality down. I mean, it works really well.
And it heals the same way. The recovery is the same.
These are rock solid pillars of implants. And they require no bone grafting. You can hook teeth to them the same day.
Mm-hmm.
And so they enable us to place a posterior implant into a person who has a really large sinus and no bone, or very little bone, and give them teeth the same day. Do the new teeth now procedure. They
That's
don't have
incredible.
to wait. Zygomatic implants.
And there are not many other doctors that are up to date with this, even still now.
There
11 years.
aren't many that have our experience level, but they're growing. Yeah, as you know, Dr. Kirkpatrick
Mm-hmm.
taught a zygomatic course in Chicago December 17, I think it was. And I went up and helped him with that, and we got a lot of good feedback from that. And
Great.
so, there are more and more people gaining interest in that, but there just aren't a lot of people who have the experience level that we have here, or that Dr. Petrosian out in Seattle has. They're just, we got in real early on the curve.
You guys are the originals.
Yeah, we got in early. Yeah.
The originals. We should just change the name. New Teeth Now, original.
Yeah.
I like it. So this is a great slide. Mini implants versus the traditional ones. Oh, mini implants. What's your thought on those?
Well, we don't do a lot of mini implants because they do not allow us to accomplish what our signature prosthetic is, which is a fixed, non-removable, same-day appliance. Which is leading up to a zirconia screw retained bridge, and mini implants do not allow us to do that. They're small, they don't have attachments, there aren't different parts and pieces, they just don't accomplish the job. They're typically placed by a lesser experienced
Right.
dentist, and they're typically used to support a denture that's removable, typically. They're not typically for fixed bridge work.
And I think
Not to say they can't be used for that or haven't been,
Mhm.
but that's not typically their application.
right, and I know that you've had a lot of cases with failed
Yeah.
mini implants
Yeah.
that you've had to then go in and remove. So it seems like a good idea at the time until a few years down the line, and they're not kind of working
Yeah.
the same way that traditionals do. So if you've been told, mini implants is an alternative, I would come in and have a second opinion. If you've been told anything by anyone, come in and have a second opinion with Dr. Richards and his team, which we'll take a quick look here. This is a bit of an older picture, but we have...
Are they seeing that team? The viewers? Okay.
They've got Dr. Richards there, and the reason that I wanted to show it as well is because you work very closely with these girls. These are the girls that are answering your phone calls, answering any questions if a patient has it after surgery. I mean, they're there through the whole process.
Right.
So these are your familiar faces, and I think that's great because I can't tell you how many times I've been to a dentist office or a doctor's office and you get a different face every single time.
Right.
And it's sort of, unnerving because you're already nervous about going, and then you see all these new people and you're thinking, well, I just explained this to, this one
It's
and
not
that
new
one.
people now, it's new teeth now. Right?
There you go.
Okay.
Not new people now, new teeth now.
So while we're talking about people, this is our anesthesia department. And Jack Patrick Daniel, and Kim Cherry are both experienced certified registered nurse anesthetists. So they're both like RNs who have additional training in anesthesia, and they administer our general anesthesia. And they do a great job. We were talking about zygomatic implants a while ago.
Mhm.
Let's just touch on this, and if the viewers are seeing this clearly, you can see
Where it goes.
that on this left picture there are no traditional, well, there is one in the middle, but basically 4 zygomatic implants. So if we see a situation where there's no bone, up to this point we've been talking about and shown x-rays of situations where there were traditional implants in the front and 2 zygomatics in the back.
Right.
But if someone has no bone,
Mhm.
we're able to place 4 zygomatic implants, 2 on each side.
That one on the end there. That one looks like.
And
there's
then
no...
the middle picture is 2 zygomatics on each side plus a couple little short ones in the middle.
Mhm.
And this one is just pure 4 zygomatic implants. And we do these procedures.
I think that one depicts it really well because you can see how there's very little bone.
These people have no bone.
Between
Yeah.
the gums.
Yeah.
Really good. Talking back on Jack and Kim.
Back on Jack.
These guys.
Very,
very important because they've been with the company for a very long time.
Now. Yeah.
With new teeth now being such a specialised procedure, you're probably going to want an anaesthesiologist or a certified nurse anaesthetist that knows what they're doing.
Right.
And is familiar with this because anaesthesia obviously requires, intubation.
Right.
And when you're working in the mouth, that's got to require somebody that knows what they're doing and has experienced this sort of procedure. And I think it's great that these guys, I mean, how long have they been with you?
Quite a while, yeah.
And
a long time.
You also have another...
Well, Kim's friend is an anesthesiologist. He rotates through occasionally, and there's one other, actually two other nurse anesthetists who come through if Jack or Kim are on vacation.
But again, familiar with the procedure, which is great because it is specialised. Like you said, not many people are.
And for the viewers, what you have to understand is that when I'm doing one of these procedures, I'm concentrating on what I do. It's not like removing a tooth or some wisdom teeth where I do the IV sedation and I take out the teeth. Okay, these procedures are done under general anesthesia. So there's a breathing tube through the nose, it goes down, and then anesthesia is administered by way of inhalation. It's a gas, and so these folks are fully asleep. And I can concentrate on what I'm doing. The anesthetist does the anesthesia. And so that works out really well.
I have been lucky enough to witness patients waking up after the surgery and asking if it was really done. Because they felt like they just went to sleep and woke up and they said, you've even asked them, have you got any pain?
You're right. Pain. I mean, it can be a 4-hour procedure and it's lights on, lights off, just like that. So there's no choking, there's no gagging, no having to stop and take a break. There's none of that because you're under general anesthesia. And IV sedation for these big cases is a disaster because you're taking a person, and a lot of them are old, and their mouth is totally numb. You're tilting them backwards and squirting water in their mouth. And if you've ever swallowed something down the wrong hole, you kind of know what that's like. And so it's just miserable. And with general anesthesia, the airway is totally secured. You're totally asleep. You don't have to worry about any of that. It's the safest way to go.
Anesthesia taking care of that. You're taking care of what you need to take care of.
That's right.
And then obviously the teeth that are being made have to be taken care of by somebody that is looking at the colour of the skin, the colour of the eyes, somebody in your lab. And who do you work with?
Well, that's Dr. Dibbs.
Perfect. And he works on site?
Dr. Dibbs is full-time, on-site, New Teeth Now. And all Dr. Dibbs does is New Teeth Now procedures. He doesn't do work on natural teeth. He's the only dentist I know that doesn't work on teeth. And so he does implant-supported teeth 4 days a week. That's all he does.
Well, it says 4 days, but
God
he's always
bless him.
around whenever needed. Let's go ahead and watch a short video with Dr. Dibbs.
Let's do that.
One of the things that really sets Florida Dental Implants apart from other offices that are doing full mouth implant reconstruction, having my own laboratory here on site, this is invaluable. Not only in terms of having the control over the quality of the product that we're making, and but the ability to, if I've got a question with the patient about, can we make this change? Is this going to be feasible? I can go across the hall, get one of my lab technicians, and all of my lab technicians have been doing this for many, many years. Bring them across the hall and they can talk to the patient themselves. So we eliminate the need for me to try to interpret the patient's concerns and questions and needs in a phone call or in a note. They can speak directly to the patient.
It was so important to me to have everything under one roof. There's no waiting. That is the advantage of having the lab on site. And they are so proud of their work that they come out to see the product. These are not regular people with regular jobs. These are master artisans that create. They truly are artists. And they're creating beautiful smiles.
It's like nothing I've ever experienced, and I don't know of any other office that's like this.
That is a powerful ending. I absolutely love that picture, that before and after.
Yeah.
It's very rare that you get patients smile in their before picture.
Right.
Donna did give you a smile.
Right.
Reluctantly, obviously, she didn't want anyone seeing her teeth. And now she's like your biggest fan.
Right.
She's on the Facebook
Right.
page for New Teeth Now all the time. And Dr. Dibbs, obviously,
Yeah,
you know.
and talking about his, work environment and how all of everything just kind of enhances the overall experience.
And then he's in charge of a team of people
Right.
that are advanced and familiar with zirconia. I mean, I know so many people that don't even know what zirconia is.
Yeah.
And you've got, you've taken the time to hire people that know what they're doing with this material
Right.
and how to use the machines.
Right. There's a good
that create
team in
it.
the lab. Yeah, absolutely.
No, I think the overall system is absolutely great. So, since we looked a little bit about Donna and how much it impacted her life, I do want to look at a testimonial from one of our patients here at New Teeth Now, David. He had an incredible experience, and I think it's something that a lot of people might need to hear. So let's go ahead and watch that video.
I feel like when I walk into a room, I light it up. My consultations with other dentists was that bone grafting was going to have to be performed, and that would make a very long and detailed ordeal. Their experience on the New Teeth Now was fabulous. The fact that I could walk out that same day, have dinner that same night, just overwhelmed me. Well, after my new teeth procedure, I feel that I've been given a new life. I'm very confident in myself. I wish I had had the new teeth done much earlier in my life. It would have eliminated a lot of pain and anguish that I experienced. It was an investment that I would do again. I can walk into a room, I feel confident, I can smile with the greatest, I can laugh with everybody, I do not have to hide my mouth. I can eat anything there is. I can eat an apple, corn on the cob, the toughest steak. Would I do it again? In a heartbeat.
It just goes to show how much something like this really does impact people.
Mm-hmm.
You know, he said that he lights up
Lights
a room,
up the room. Right.
when he walks in.
Right.
And just that feeling. So he's been in the dark all this time, and then this one surgery has changed his whole outlook. And he feels, he's not invisible anymore.
Right.
Everyone can see him.
Yeah.
I just, if anybody is feeling that way, if anybody needs a consult, I really, really urge you to book in with, Dr. Richards.
I think you must be a psychologist.
Who?
You.
Me? Oh, you like my... Well, I really feel like that's how he portrayed himself in that video. It was so genuine.
No, that was very nice and very genuine.
Yes.
And,
there was and you must feel great. I mean, I can't imagine I feel great being part of just the New Teeth Now team.
Yeah.
But being able to provide that
Yeah.
and, created what you've done and give people that back. He said
Yeah.
he'd do it over again in a heartbeat.
Yeah.
Here's a quick picture of a before and after, and I believe they're the same age. Am I correct?
Well, this is a picture of a zirconia bridge on the top and an acrylic bridge on the bottom. And so the acrylic material is what we provide for the first set of teeth. And a person would end up wearing this for 6 or 7, maybe 8 months.
Not that particularly.
Something made out of that
Similar.
material.
Yeah.
And then they would be transitioned to the zirconia porcelain material. Now, some practices don't provide zirconia. Some practices provide an acrylic prosthesis for the final product. And so these are both about 5 years old.
Sorry, just to interrupt. They do provide a different material for your final teeth, but it's an upcharge. I think that's
That may
a
be
very
true.
important question
Yeah.
to ask when you're calling around and getting quotes, because obviously that's our number one question right now is how much is it, and we are going to go over prices shortly. But people do need to ask, what is the final product,
Right.
and what's it made of, and is it included in my price? Because you're making an investment.
Yeah,
To
and
yourself.
the acrylics wear, and they are porous. They will absorb stains and odors. They're hard to clean, and the teeth sort of look dead, whereas you're having light reflection off of these, and they look more natural. And this is a glazed porcelain surface, so it's not porous, and it's easy to clean, and it doesn't absorb stains and odors.
And it's handcrafted in the lab
It's
to fit.
well, it's actually made in a virtual environment, so it is sort
Oh,
of
really?
handcrafted virtually.
Wow.
Yeah.
They hand paint them though, right? To get the right
Now
shade
that
and colour.
part, the
Yeah.
addition of the porcelain is handcrafted
Wow.
by a technician. Yeah.
I just love that whole aspect because nobody's teeth are the same. My teeth
Right.
wouldn't look good in your
Right.
mouth, vice versa.
And our teeth are uneven and have little ripples in them, so you can see the light transmission. Whereas with the denture teeth, it's very obvious what they look like.
So let's take a look at Shauna and Debbie. These are your 2 implant coordinators.
Another part of the team. Remember, the
Yep.
team is you've got the surgeon, the restorative dentist, the anesthesia department, you have the laboratory professional people, and then you've got the treatment coordinators. So it takes everybody to pull this off. And that doesn't include all the other people behind the
No, I
scenes.
know.
Okay, that doesn't include my team of people, and everybody else.
Ted
And
running
just,
the cameras.
just doing this presentation tonight. You've got Ted and Jason here. I mean, to put all of this together, it's a lot of work and effort.
Well, we
and-
want the word out there. We want to be able to change people's life.
Shauna and Debbie are just another part of the puzzle. And Shauna and Debbie have been with this practice for a long time. They both were surgical assistants and moved into this role. And they are the 2 people that if a person comes to the office for a consult, then they will see either Shauna or Debbie. And
Not
Shauna
if.
or
When?
when?
When
Okay, when? And
these
Shauna or
people-
Debbie will be their tour guide through the practice.
And that is the other reason I wanted to show you their face so you're familiar with them, just so that you can get an idea of who you're going to be with and who's going to coordinate your treatment. You're going to sit with them in a room.
Right.
Once you book a consult, let's take a little look here. This is a CT scan, which I cannot believe you guys include for the $50 prepay. So when our patients want to come in and see you, because they're going to have a lot more questions than what we've answered so far, when they come in and they see you, you include a CT scan.
Right. Well, we set up for the initial visit about an hour. And they come in and, you know this, you've kind of sat in on that, but Debbie or Shauna will review their medical history and take the CT scan, and Debbie and Shauna know enough about CT scans that they sort of go over things with them a little bit, and then they will get us, and Dr. Kirkpatrick and I will go in, and then we go over things in detail. And I always ask people, how'd you get here? Tell me about your journey, because some people have an interesting journey
Right.
to find themselves here. And so, listen to their story, so to speak, and review the scan, because the scan is going to show us the bone, and it will show us what we are able to do and what we are not able to do. And then reviewing the patient's medical history, and this is something we don't talk about a lot, but we're talking general anesthesia. And so if you're going to have general anesthesia, you need to be reasonably healthy. And most people in the age bracket that we're talking about have a physician, primary care doctor, cardiologist, pulmonary doctor. They have someone,
To clear them.
and they're on medication, and so we get a medical clearance for general anesthesia on an outpatient basis from their physician.
And I don't.
And lab work and EKGs, and we do everything here that we do when we take a person to the hospital. It's the same standard that
Right.
the anesthesiologist at the hospital would want to see before they would put a person to sleep in the operating room for us at the hospital.
And that's very important, but I don't want it to discourage anybody from coming for a consult, because $50 is completely worth it
Yeah.
if they can get clearance.
But we do a comprehensive review of all of that, and we're able to tell a person at that first visit what we can do for them,
Right.
and tell them how much it costs. And Emily is going to talk about the money in a few minutes, and the only thing I'm going to say about that is we are not traditional, because we do not charge people by the number of implants we place.
No, or by the hours that you put in.
We do the job. We'll do your upper jaw, we'll do your lower jaw, we'll do both, and Emily will go over the fee schedule.
We do have one question that I don't believe I answered, and it was the last one to come in. We kind of covered everything else amongst talking. But somebody was asking about an underbite. Now, if they are in need of the new teeth now procedure, that underbite will be fixed, correct?
Well, the implants have to go where the jawbone is.
Okay.
So if a person has sort of a normal bite relationship, then the implants will go into the jaws and the teeth can be lined up in a normal relationship. If someone has a bite where their jaw is like way out, let me get my hands out of here, where their lower jaw is not in a normal bite relationship, but let's say their jaw is like sticking way out, well, the jawbone is way out there, so the implants would have to go way out there, and so we cannot fix that.
Okay.
Now, we could do a surgery on their jaw to move the jaw backwards and fix everything that way.
Okay.
Some people have a jaw bite relationship where their jaw is back this way. We see that more often. And what we have found is that they have been used to living with their teeth in that where the top teeth are here and the bottom teeth are sort of back. And if you take a person like this and you move the bottom teeth out into a normal bite relationship, a lot of times they just can't stand it.
Right, they're not used to it.
Because they lived their entire first 70 years with it back like that, and then you move them out into what we look at and we go, oh boy, you got a really nice bite. And they go, I hate it. You know, we need to go move it back to where it was. So we do that quite often, and we don't try to correct every little thing like that, because sometimes that's just not what that person needs or wants.
Well, I think in answering their question, it was very honest. I think that that person does need to come in for a consult.
Oh, absolutely.
Get an X-ray. Don't be, discouraged that you aren't going to get your bite back, because I've seen some underbites and overbites transformed. I mean, this is not really an overbite or anything significant going on here, but we have a before and after, and just looking at the before and after there, and her jaw looks a little like protruded down at the lower jaw.
She just don't want to smile.
Yeah, that's pretty much everyone. I don't think we
Yeah.
have very many. I love.
Of course,
this
we
one.
know Bruce real well.
Yes.
He's
If
a
you
local guy from Kissimmee area.
If you look up any of our other webinars, he's got some of his testimonials also. So we look forward to hearing from you. Please call with any questions or any feedback that you have, and I hope that we are able to assist you in your journey. Thank you, Dr. Richards.
Thank you for hosting this.
Oh,
I appreciate it.
thank you for having me host it. I appreciate you. Well, you guys have a great evening, and thank you for watching. Bye-bye.
If you would like to view more informational videos on New Teeth Now, please click the subscribe button here. Thanks for watching.